Try a fart walk. Hemorrhoids are normal parts of our bodies. I'm going to teach you what your poop means according to its Pantone color.
There is no topic too taboo for Dr. Trisha Pasricha.
Gut health, very popular right now. And that's a wonderful thing. I think a lot of times discussions about our bowel habits, how our stomach feels, was like a conversation you had in private.
Pasricha is a gastroenterologist at Beth Israel Deaconess Medical Center, an assistant professor of medicine at Harvard Medical School, and in her spare time, a columnist for the Washington Post.
We answer all the questions that people really want to know the answers to, but don't necessarily feel like they have the time to ask their doctor in those crammed 15-minute appointments.
With more than 111,000 followers on Instagram, she is spreading the word about health trends, new studies, and subjects some people are too uncomfortable to talk about in person.
People are sometimes even embarrassed to tell their doctors about these problems, right? And I'm a gastroenterologist. I have chosen to do this for a living, and people still feel embarrassed to tell me.
This daughter of a gastroenterologist doesn't blush at much. She's been hearing about the digestive system since she was a child.
I've found patients feel like, oh, if I tell you all about like my flatulence, my gas, my bloating, you're going to judge me. Sometimes I think we just have to be as real with our patients as we are with our family members, and then everyone in the room can just like breathe a sigh of relief and just talk about their problems.
Reducing the stigma could drastically improve health outcomes.
Everything that we put into our bodies, the gut is our first line of defense.
If you're looking for ways to improve your overall gut health at home, you don't need to completely clean out your kitchen. There are small changes you can make.
I start with fiber. Okay, 95% of Americans are not getting the recommended fiber in their diet every day.
Increase intake with a fiber supplement or by adding nutrient-rich chia seeds to breakfast. A variety of high-fiber vegetables with lunch and dinner will also help.
If I say, like, go just like suddenly eat kale salads every day for the next month, nobody's gonna stick with that.
Next, cut back on ultra-processed foods.
We get 90% of our sugars in our diet from ultra-processed foods. So when you're looking at these big confusing nutrition labels, just hone in on the added sugars.
Lastly, alcohol. It's been linked to dementia, increased cancer risk, and decreased gut health. Try to cut back on consumption by opting for a non-alcoholic beverage instead.
Let's make a real small swap, like a small substitute now, but one that you can sustain for years or maybe even lifelong.
Karishma Swaroop is also using social media to educate and fight misinformation on another topic that may make you blush: sex.
I started my Instagram page while I was quarantined in COVID and called it Talk You Never Got.
While she was an undergrad at Brown University, Swaroop joined a volunteer group trained by Planned Parenthood to teach sex education to high school students.
People think sex education is teaching people how to have sex, but it's really not. It's so much more than that. Of course, there's some stuff about STIs and preventing pregnancy, but it's also so much more about the socio-emotional skills around consent, healthy relationships.
Now a master's student at the Harvard T.H. Chan School of Public Health, Swaroop's Instagram account has grown to 57,000 followers in both her native India and the U.S.
I was very surprised that most of my audience was actually 18 to 35, young adults.
The constant in most of her guidance: communication, both between partners and between parents and their kids.
Thinking about it less as a one-time talk that we have and more as something that's sprinkled in. This is a safe, okay thing to talk about with your parents throughout. I think that is way more important.
Swaroop says there's also been an important cultural shift around consent in recent years.
Shifting from talking about consent as a one-time, like, I have asked you, are you into this, versus a practice and a culture where we check in and it's not like you're not covering a legal basis, has someone said yes, but rather, are you creating an environment where both people feel mutually respected, where both people feel like they have the option to opt out at any time with no consequences.
And as the tone of these conversations shift, so do the social norms.
What we're allowed to talk about with our friends and like as a society also enables us to talk about those things with our healthcare providers. They've studied across countries that if you give people sex education, they are having safer sex. They are having sex later because they know some of the risks involved. The health outcomes tend to be better.
And back to Dr. Pasricha. She has a new book coming out called You've Been Pooping All Wrong. It hits the shelves on April 7th. And she also points out that women still today too often and disproportionately are being dismissed by their doctors.
Dismissed, and she recommends that women are very specific with their doctors about how something is affecting their daily life, be able to give examples and even make it personal and say, if I was your sister, what would you recommend for my treatment?